Hi, I'm Dr. Messina. Today I'm going to discuss a topic that gives a lot of confusion to a lot of patients, the reconstitution of Botox. Why do we have to do it at all? Sometimes patients confuse reconstitution with dilution, which is very different. So let's take a look at the video and see exactly why we have to reconstitute Botox. When dealing with Botox, we usually have a 100 unit package, and it has to be reconstituted into a liquid form again. When taken out of the packaging, the small vial has the Botox powder at the base. As you see, it looks empty, but it's not. It has to be reconstituted, normally with normal saline. Now, for demonstration purposes, I loaded these syringes with milk just so it would show up better against the brown background, since Botox is crystal clear. Now, in syringe 1, 2, and 3, each of them have 100 units of Botox in there. The first syringe right here was diluted or reconstituted with 1 cc of the normal saline. Syringe number 2 was reconstituted with 2 cc's of normal saline, and syringe number 3 was reconstituted with 3 cc's of the normal saline, and all 3 of these syringes would be loaded with 100 units of Botox. Now, when a patient questions, well, what's the difference if you use 1 cc and my doctor uses 2 cc's? Well, there wouldn't be any difference provided that the person using the more diluted or reconstituted strength is compensating for the increase in normal saline that's in the syringe as related to the dose of Botox. So when we look at this, these are the syringes we usually use, tuberculin syringes, or in this case insulin syringes. If I wanted to give 5 units, this is the amount I would give, provided I wanted to give 5 units, and that would be from the first syringe. A syringe that was diluted with 2 cc's, I would have to use, again, this tuberculin syringe or insulin syringe would now give 5 units in this volume. If I used one that was reconstituted at 3 cc's, the bottom one, I would have to give an even greater volume of the fluid to get the same 5 units that syringe 1 has. Just to show you, I'm going to demonstrate how it would be on the countertop. Here we go. This is 5 units from this syringe. 5 units from a syringe that came from a needle that was diluted with 2 cc's. It's twice the volume. And 5 units from a syringe that was diluted with 3 cc's. Now this is going to be even more volume. So why would we use one versus the other? The very common one is to use 1 cc because, as you can see, more potent concentration is in there. Therefore, we have to give less of a volume to the patient. It's much more comfortable, less bruising, less irritation than these two. It would be perfectly fine to put 2 cc's in there, but you would have to make sure that you give twice the volume. The one time you would use 3 cc's, there's a caveat for that, would be when you're doing axillas for hyperhidrosis, extra armpit sweating. In that instance, you need the larger volume. So, as we see, reconstitution is just making the Botox go back into its liquid form. And whether they dilute it with 2 cc's or 1 cc really doesn't matter much, provided that the person who dilutes it or reconstitutes it with 2 cc's gives twice as much volume to make up for the difference. Dilution, on the other hand, what patients are worried about, that would be if you already reconstituted it and then added more saline in and diluted it down so that each little cc is actually giving you less Botox. That's a very different thing, and it's an unethical thing to do. So reconstitution is good. It has to be done to get the Botox to work, and I hope this resolved a lot of your questions. Have a great day.